In the new episode of COVID.Chronicles, we will tell you where the first batch of vaccine for Kazakhstan arrived. Doctors are dying in the fight against coronavirus. Let's remember those who fell victim to the dangerous disease. To giving others light, they burn themselves. Ivan Ivanovich is a person like this. They have tightened quarantine measures in the Netherlands. No way you can be outside after 9 o'clock or you will be fined. We will tell you how to survive the post-COVID syndrome. Here are the very simple recommendations. The first batch of Russian vaccine Sputnik V was delivered to Kazakhstan. Minister of Health Alexei Tsoy announced it on his Facebook page. In total, 112,000 doses of vaccines will be supplied in February, 150,000 in March, and 600,000 doses monthly from April to June. The story of how I got into medicine is very long, but in short, it happened thanks to my mother. Since I was born, my mother told everybody that her son, Ivan, would be a doctor. Ivan Ivanovich is remembered as such a bright, cheerful man, loving his mother and family. We often were on business trips abroad, and he often remembered his mother, his children, and grandsons and granddaughters. He loved life very much, and at the same time he was very involved in his profession. He had a deep knowledge of almost all issues of healthcare. You could hardly hear from him the words, "No, this is impossible." Facing a challenging situation, he suggested sitting down and think, and it worked. The solution was found. He implemented the 3H system following international standards. Under this system, we accepted foreign patients, and today this system is used. He implemented the 3H system, which is used by the whole country. It has improved the work of emergency rooms. The flow of patients has been distributed. I want to remember about him. It is very hard to use past tense speaking about him. He was very human, a very high-level professional. Every day we learned how to speak correctly, not only how to work. We learned by listening to his correct speech, learned his thinking, his strategic planning. He wasn't just thinking about today's problem, he was thinking 5 years ahead. Ivan Ivanovich organized quarantine inpatient facilities in hotels. More than 1,300 beds were prepared in various hotels. The inpatient facility was an additional load for him. At the same time, he worked with all foreign planes that landed in the city of Nur-Sultan. He was there to organize the necessary process. It was very hard. He stayed up for days, didn't go home, spent nights at work. Ivan Ivanovich was very athletic. He always found time for sports, always found time for personal leisure. During the pandemic, he didn't even have time to sleep, to eat well, to rest. On June 19 at 8 a.m., Ivan Ivanovich told me that he tested positive for coronavirus. He underwent a PCR test in the morning, and the result was positive. He was taken by ambulance to the City Infectious Disease Center, which had opened recently. He stayed there for about a week, and then after the condition worsened, he was transferred to the National Cardiosurgery Center and stayed there until July 25th. I called him to ask one question, and he was already in a hospital bed when he answered the phone. That's when I found out he was sick. He was managing the flows of patients from there. I wondered why he was coughing. He said that he was in hospital. I just called a few days before he died. In a few days, I called to ask one more question. His phone was off. Afterward, I learned from my colleagues that he had to be connected to a ventilator because the complications started. Then we all knew the sad news.
Ну, потом всем нам известная печальная весть через некоторое время.
Причиной любого заболевания – это снижение иммунитета.
The cause of any disease is a decrease in immunity, and immunity decreases when a person doesn't rest, doesn't sleep, doesn't eat. We worked for the whole city because all clinics were closed and they organized infectious disease beds. We were a clean zone. We worked for the whole city, but to provide medical care, a sufficient number of doctors were required. There were not enough doctors in our hospital. That's why all responsibility was taken by the head, together with his deputies. All this affected him. It was a stressful situation. Everyone was in a panic. It was for the first time. Not every year such a pandemic with a large number of infected and death happens. What could a doctor do? Patients came to him asking for help. A doctor who considers himself a doctor can't refuse. As the saying goes, to give others light, they burn themselves. Ivan Ivanovich was exactly such a kind of person. He worked with patients to the end. Not just he worked with patients, he managed huge workflows. And we experienced a real collapse. He behaved very modestly everywhere, despite his great virtues. But people said how great he was. His son came to us after his death. We had a posthumous award. Anton Ivanovich, his son, said that when Ivan Ivanovich talked about us, the staff, at home, he never called us subordinates, but my people. He used my to talk about us. That is, he accepted us as family.
Одно время было такое, что у нашего сотрудника сгорела машина.
Once an employee's car burned down. It happened right on the way to work, near work. He had bought the car on credit. In the morning, everyone goes to work. The car is on fire near the hospital. Everyone knows that he bought it on a credit. After learning about this, Ivan Ivanovich gave him a car as a gift for Medicine Day. Our colleague, an anesthesiologist, reanimatologist, cried with joy. No one expected such a surprise.
От радости плакал, никто не ожидал такого сюрприза.
Но жизнь продолжается. Дело начатое.
Life goes on. We continue the work which was begun when Ivan Ivanovich was the head of the city hospital number 2. In our particular case, we continue to implement his ideas. The whole ideology and strategy of the hospital have been preserved, and the Department of Health contributes to it. We will do everything to ensure that the blessed memory of Ivan Ivanovich lives on with us, and his ideas live on. I always said to Ivan Ivanovich that the most important thing for me was to work together with you, next to you, with a man like you. The whole country knows him. All Kazakhstan knows how great he is. He was, unfortunately. Since the beginning of the COVID-19 pandemic, about 1 million coronavirus cases have been reported in the Netherlands. Now the country has strict quarantine measures in place. We contacted Aruzhan Minzhanova from Kazakhstan, who is studying in the Netherlands. Aruzhan, thank you so much for agreeing to an interview with us. Could you please tell us about the coronavirus situation in the Netherlands?
Да, конечно. Я сейчас нахожусь в Maastricht, это провинция Limburg.
I am in Maastricht, which is the province of Limburg. To be honest, in the Netherlands, the conditions have changed a lot compared to March. Before they relied on citizens, but now they rely on the state. That is, the state imposes restrictions. Before they recommended keeping a distance of 1.5 meters. Now it's no longer a recommendation, it has become mandatory. For example, when two people walk along the street, they should keep the distance of 1.5 meters. Everything is closed now. Everything except supermarkets is closed. As for studies, they are partly online, partly offline, but more often they try to limit it. It all depends on the university and the place. You've called me right after they imposed stricter quarantine measures, so now you can't be outside after 9 p.m. or you will be fined. To be honest, people are morally depressed. You can already see it. Everything is closed and, for example, you can only invite one person maximum to your home. It is forbidden to invite more people. The citizens didn't even wear masks before. They don't like it, and now they're starting to get used to it. Now everybody wears masks on the street. So it appears that no places work during the day. There is no place to go to have fun. It is not possible to do anything. Exactly. To be honest, for entertainment, there are supermarkets and drugstores. Unfortunately, everything is closed. It was closed from March till summer. In summer, all places worked for 2 or 3 months. In August, September, they started closing all the entertainment facilities. The critical situation has been going on for 4 months. They have tightened measures since December because coronavirus cases, the number is much higher than in Kazakhstan, grew faster. Now, thanks to the measures, the number of cases is decreasing. The authorities, you could say, are encouraged and have introduced even stricter measures. Now, parks are the main entertainment facilities. I would say there are not so many people on the street because in the Netherlands there are a lot of elderly people and they also try to comply with these measures. Since the beginning of January, vaccination is already mandatory, or well, it is optional. It means that health workers are already provided with vaccines. It is the German vaccine, if I'm not mistaken. Aruzhan, thank you very much for the interview. Take care. I think, in general, post-COVID syndrome rehabilitation are standard. There is a program approved for adoption by WHO, where the basic management approaches are developed. The program is acceptable for adults. It can be used to work with the lung volume, to conduct rehabilitation for the immune system, to ensure the appropriate hemostasis. But there are still cases and options where things don't go in a typical way, and in those cases, you need a multidisciplinary team. There are cases when one doctor with a ready-made protocol can't handle the situation. Adults come from COVID and can't deal with their emotions. They can't sleep, they have panic attacks, depressive syndromes. In these cases, the general practitioner should probably work with psychologists, neurologists, because it all affects the transmission of nerve impulses toxically. Sometimes antioxidants are needed, sometimes cardiovascular drugs are needed. In this case, the recommendations are very simple. People who have had a healthy lifestyle have a big advantage over people who smoke or drink alcohol. So you need to ensure the necessary amount of sleep, timely sleep with an adequate release of melatonin. It is important to fall asleep before 1 a.m. to wake up in time. It depends on the individual. However, drinking water, exercising, walking, even positive thinking have a good effect. Everything in the body is well connected.